Hello, welcome to my live stream session. Today we'll be talking about the shocking truth about folic acid during pregnancy. Folic acid is also known as vitamin B9. So essentially it is important to take folic acid to help prevent certain birth defects in your baby. Folic acid and fesolate are two forms of the same vitamin B family. Fesolate is the form that occurs naturally in food, while folic acid is the man-made form. So, folic acid, fesolate is found in our day-to-day food, while folic acid is the man-made tablets. Do we get added to multivitamins and fortified food? Your body needs folic acid actually to help you make new cells. So to the body needs folic acid to help make new cells, especially babies who are just forming. It helps them make new cells, which includes brain cells, blood cells, DNA, RNA, and the genetic material inside their cells. During pregnancy, you need more folic acid because your baby's body needs it to develop. Folic acid helps your baby's brain and spinal cord to develop normally. It cannot be overemphasized. Taking folic acid can significantly reduce the risk of neural tube defects in the development of your child. It is called an embryo at this stage because the baby is not actually formed, so they are still embryos. These neural tubes begin as a tiny oval shaped piece of embryonic tissue which folds into a tube about 28 days after conception. When this tube closes properly, it continues to develop into your baby's brain and spinal cord. If the neural tube does not close due to the lack of folic acid in your diet, your baby may have a neural tube defect such as spina bifida or encephaly, that means absence of brain. In spina bifida, the neural tube to fails to close at the bottom. That's why you see that round thing. You see the picture, that thing that looks like ball at the back, like where the spinal cord is. As a result, the part of the spine that enclose and protect the lower spinal cord does not completely form. This folic acid thing is dangerous, so if you don't take it, allowing the cord to protrude. Children with this defect often require surgery or have permanent deformity or disability, including leg paralysis, developmental delay, and nervous system problem. In the condition called anencephaly, the tube, the neural tube fails to close at the top, preventing large part of the brain and skull from developing completely. Babies with this defect are unable to live, one, usually die before birth or soon after. 2. Folic acid may also protect against other birth defects such as clip lip and clip palate and arterial spital defect. I don't even know what that means. Which is when a hole, okay, so this is what it means now, which is when a hole between the right and the left upper chambers of the heart fails to close during development. Hmm. I say I should read this thing to people so people will see the plenty consequences that comes with not taking folics during pregnancy. Please do not forget to give me a thumbs up. Don't forget to subscribe. Don't forget to comment. My life varies from different things. I teach important issues that I know that some people don't know. So I come here to talk about it. My regular posts also the same thing. My little knowledge in healthcare, I bring it out for us all to share. No man is an island of his own. Don't forget to double tap the screen, give me a like, give me a thumbs up. Let me know I'm doing a good job. Let me know you understand what I am teaching. So there's also a video that I posted this morning about explaining this same thing I just explained here. So you can also go to my playlist and stream the video. Also need to, you can share to your friends, share to your family members, post on your social media so that people understand the danger behind not taking their pregnancy routine drugs. The folic acid is also good. Let me even chip this in. Folic acid is also good when you are trying to conceive. Maybe you're having delays a little. If you're having delays, you can start taking folic acid. So I was talking to my friend today at the clinic, and she was saying, "Oh, okay." So she saw my YouTube page and saw this this particular video about what happens if you do not take folic acid during pregnancy. And she was like, when she saw the picture, she was like, that her brother, so I gave birth to one of their children have this thing behind his back and he cannot walk. I said, yes, that is what is called spinal bifida. I had to tell her to go and watch the video so that she educates more. That's not when she now told me that she remember when she was trying to conceive this her last baby. The pregnancy wasn't coming, and someone in the UK or in the US, one of those countries, advised her to start taking folic acid. And she didn't even take it up to 3 weeks or a month, and instantly she conceived. So you can also give it a try. If you're trying to conceive, try taking folic acid. It's not bad for you to take, but the only way you're taking it, take it is once daily. Folic acid is taken once daily, is 5 milligram. So you take it once daily. Sorry. I have catarrh, so I, I'm under the weather. I have flu. So sorry for hearing all the dragging of my nose. Let me know in the comment section what else you want to know, what you don't understand, what is getting you confused, or if you want me to explain a particular topic, I will help you do that. I'll go, if it's for me to research more, talk to health workers, I will do that, and I will teach it so that you understand it better. So it is advisable, it is important, it is essential. What are those words that they use? For you to take your folic acid when you are pregnant. I will keep hammering it because I do not want anybody to go through any emotional stress. The danger behind not taking folic acid is higher than when you say you will throw it up. When you say I cannot take drugs, I do not like drugs, does it have an injection form? I hear all those sort of questions during antenatal clinic in my hospital. Can I take it in the form? Is there injection for it? Can I be taking injection? I do not like drugs. Oh, folic acid smells. Folic acid does not smell. If you say folic acid smells, what will you not say about vitamin B complex? That thing smells more than folic acid. So how are people saying folic acid smells? Please take the damn drug. So that tomorrow you will not come and be running helter skelter, going for surgery, praying for miracle, when you could have done the needful. Yes, miracles still happen. Miracle definitely happens, but you can be prevented. So if you can prevent it, why not even prevent it? So do not tell me that no, it smells, you cannot take it. I do not like drugs. If I take drugs, I will throw up. All this, or I have given birth to two children and I didn't take folic acid, nothing was wrong with them. You do not know how this third one will be, the outcome of this third one. So no play. Oh. Do not play. Do not play at all. Better safe than sorry. Anyways, when you are taking that drugs or when you are rejecting it, just you keep hearing my voice. Take your drug. It is essential for you. Take your drug. You need to take your medication. All these drugs that they are giving you in the hospital, nobody wants to shove drug in your throat. It's for your own good and for the betterment of your child. No doctor gives you drugs that is not important. So do not think that when they're just packing drugs, they want to collect my money. How much is folic acid, fesolate, or SP that they want to collect your money? Please take the damn drug to help your baby develop well. It's not the one tomorrow you'll be struggling, you'll be running from pillar to post, going for surgery, praying for God to heal your son. This one, it's a village people. Village people is not inside this matter. It is that you do not take your folic acid and fesolate when you're pregnant. It is why you are running helter skelter. It does not have anything to do to village people. Village people are, those women don't even suffer. Sef. Everybody village people. Even the innocent ones self, they are still village people. Please, it is important you take your drugs. So this live section will end in about 13 minutes. I felt it heavy in my heart to come and discuss it. Maybe to turn to Sermon 1, Sermon 2, Sermon 3. So we'll keep preaching it until we all get to that place where no hospital has a record of any child with any developmental defects as a result of folic acid, majorly spinal bifida and anencephaly, because they come hand in hand. They are they are in the same. They come hand in hand. So you need one comes with the other one because everything has to do with the development of the footer of your baby, whichever way you want to understand it. So it is essential, it is paramount, it is important, it is just be looking for the word to it. Is what folic acid is in your body. So you can also go and check the whole folic acid helps to conceive. If you are struggling with maybe a few years of infertility, you can start taking folic acid. Like I said, my friend told me to do that. She did that when she was having a little delay in conceiving. Between 3 weeks to 1 month, she started taking it. She took in. So it works, and I've heard other people say it before. It's just something I've not really sat to research on. So folic acid is good. It's not even me. I take folic acid at times, but when you're taking it, take just 5 milligram, one one a day, one a day, one a day. Oh, is when you're taking ferrous sulfate. That is one morning, one evening. That's one in the morning, one in the evening. Then SP is you take the whole three, but you take this 3 months. Go according to your gynecologist's prescription. Not say na me say. When you go to the hospital, they definitely give these drugs, and how you will take them is always written there. So welcome to my life channel. Please do not forget to double tap, give me a thumbs up, like, subscribe, share to your friends. There's an actual video about it on my channel. You can go and download, you can watch, share to your friends, so that this awareness goes round. A lot of people are struggling with this. I Even from my comment, I had somebody say, "Oh wow, I didn't know." So a lot of people do not know the side effects of not taking folic acid or taking their routine drugs during pregnancy. So please share to people so that they are more aware, they are educated, they are enlightened to know the repercussion of all these things. If you haven't subscribed, what are you waiting for? Subscribe to get first-hand healthy tips relating different regarding different issues. And if you also want me to talk about some certain issues, just send me a message on Instagram or Facebook or TikTok. My handles are in my bio. Send me a DM. The one I can answer, I will answer. The one I cannot answer, I can bring a doctor to come and clarify it. We are all here to learn. We are here to learn. We are here to learn. We are here to learn. You learn, I learn. We are here to learn. We are here to learn. So, I said I was going to end this meeting in. We have 8 more minutes. I need to go and sleep. Tomorrow is church. Tomorrow is church. Tomorrow is church. Tomorrow is church. Anyways, so that is it about spinal bifida. The first time I actually saw a child with this thing was maybe 3 to 4 years back, when my NGO was to support a child to do the surgery, and that child also had a an undeveloped brain. to just put it that way. That is anencephaly. Anencephaly. Man, no bite my tongue, I beg. And that they were twins. The baby, the sister was all right. It was a boy. I don't even know how he is right now. I can't. I don't have the parents' number again. So that's the first time of me seeing something like this. I was shocked. I was like, what is this? Then I wasn't even this well informed. I wasn't this, but we did. We paid my organization paid for the surgery. The surgery was successful. Then the baby also came out with clip foot, so we had to buy shoe for the leg. Then did VP shots for because he said he's had Josephilus also. My dear, you do not want to be in the position of all this wahala. Better just take the drug to save yourself English that you will not know how to speak later. Because as a mother, you will now be regretting, you will now start feeling, oh, I wish I knew, I wish I knew, I die know, I die know. The whole before so you don't get to this I die know stage. I beg you just good to just take the drugs. I beg. 6 more minutes to go. Please do not forget to like, subscribe, share, double tap the screen, give me a thumbs up. You can drop me a comment. If you want me to treat any other topic, let me know. I will do justice to it. Why am I here if it's not for you? If it's not for you people, that is why I am here. I am here for you people. We are here to learn together. We learn and unlearn and relearn. And which other learning is available again? Audio learning. So we are here for all that. Do not forget to like, to share, and subscribe. Don't even know why I'm even singing this like, share, and subscribe. So, anyways, I'm under the weather. I've taken medication, but this thing, this weather is not even funny again. Thank you for watching. Thank you for coming into my life. We are discussing the adverse effect of not taking folic acid during pregnancy. This title self don't I don't turn upside down. I've said it like this. I've said it that way, just for people to try understand that if you don't take folic acid, there is a problem. That's why I've been turning these words upside down. The adverse if side effects, the importance of taking folic acid, the gbogbo everything. Sha. I shall be saying it like that, so that we can all understand. Thank you for joining in. Please give me double tap the screen to give me a like. I mean, I'm doing something. I'm educating you. I've heard people say, "Oh, I didn't know that this was it. I didn't know this is it. I didn't know this is what happened. This is the reason why some children have this thing." It is part of the reason. Oh, they do not take folic acid. It is part of the reason they did not take folic acid. And most children who have spinal bifida don't walk because obviously now you cannot walk now. Spinal bifida is spinal cord. So if the spinal cord is not properly formed, how the person want to walk and the brain is not properly developed. So a lot of defects will be there. Cognitive defects will not go there. So we get it, we get it, we get it. I don't want to say we get it, forget about it. That is like a very rude something to say. We get it, we get it. 2 more minutes to go, 2 more minutes to go, 2 more minutes. Welcome, welcome, welcome. We're gisting, we're gisting. Come in, let's gist. Were you aware that um, folic acid has this kind of effect on children? Please drop me a comment, let me know. I've had people say, oh, they don't know, oh, they don't know. Let me know. Yeah, have you had experience? Have you seen a child with spina bifida or anencephalis and all those defects that comes with stuff like this? Let me know if you have seen something like this. Let me know. 1 more minute to go. So I hope I've been able to educate you on why you should take folic acid when you are pregnant, when you are trying to conceive, before and after pregnancy is very good. You can take folic acid if you're trying to conceive. Just try it for a month. My friend told me that she did try it and it worked. Yes, I go to work on Saturdays. So I'm a nurse assistant. I'm on morning shift, so I work on Saturdays. Hospital, we that work in the hospital, we work every day of the week except maybe you're off on those on weekends. So thank you for joining my life. Thank you, thank you, thank you. It's my pleasure to connect with people today. We will see tomorrow at about 8 p.m. So come back to my live section tomorrow by 8 p.m. God's willing. And on this note, I bid